Please go ahead with your introduction. And please unmute your device. We are not able to hear you.
Sorry. So I'll start with my name. Neha means love or affection. So what I feel I can say is I find it hard to hate anyone, come what may, whatever happens in the life, or sometimes some wrong things are done. So I just spread love and affection. So that's what I feel proud about my name. And basically, I am an anesthesiologist and have over 25 years of clinical work experience. I started my career from Dharamshila Hospital Research Center, and now is Dharamshila Narayana Super Specialty Hospital, and that I started in 2001. And along with that, my journey of quality system and processes started in 2002, which I started with the ISO certification, policy, procedure, everything. So been into the quality for that. And since 2009 onwards, I headed the Department of Anesthesia and Critical Care, also became the NABH assessor in 2009, then did my PGDHHM in 2013 from IGNU, and did my MBA from FMS in 2016. Wanted to go into admin, but all along that line, I was very much attached with the patient safety process and procedures. So I did patient safety specialization in 2020 from Johns Hopkins University. So now this program, I'm very passionate about the patient safety, and along my career also I have been doing in my own way the how to go about the healthcare communication a little bit part. So I am here to learn the nuances and to carry my passion for patient safety in this journey.
Absolutely. And I'm sure it's going to be a very rich experience for all of us. Thank you so much, Dr. Neha, for introducing yourself. So whom do you want to pass the baton?
Dr. Amrit.
Hello, I'm so sorry. Has gone really bad, and I'm not able to get anything. Is it possible that I connect with my phone for the audio and keep iPad?
What you can do, you can actually, for the timing, you can switch off your video. Maybe your audio quality will improve. Then you can join from your phone also. If that works, it shouldn't cause echo. Sometimes it causes echo. If you join from two devices.
This is what I'm trying to do. Can you meanwhile I'll set it up for myself?
So if you want to settle
To
down, we can
someone
ask you to
else.
go to the introduction. Yeah. And then once you're ready, you can raise your hand.
Yeah, this is what I'm saying.
So maybe Dr.
Yeah,
Manish,
this is what I'm saying.
Dr. Manisha, if you're ready, you can introduce yourself.
Thank you.
Yeah, good evening, everyone. As my name suggests, it suggests knowledge. Manisha is Vidya, knowledge. So there has always been a continuous learning throughout life, whether it is through life itself or whether it is by taking any course. And I am also a healthcare professional. I was a clinical gynecologist working. For the past 2 years, I had a passion of improving healthcare regarding patient safety, as Dr. Neha said. So I'm new into medical administration, and I also find that communication is a tool where a lot can be done in place of administration and patient safety, because it is about right communication at the right time. So I was searching for it. I'm very fortunate, Dr. Indu, that I was searching for some leadership thing in healthcare, because I'm very passionate about trainings also. I am a life skill coach. Besides, I have done MBA in healthcare, and I used to do personal safety trainings and life skills for students and for teachers in these schools. So as I was searching on LinkedIn and I tried to connect to a lot of people, I found you. And after reading about you and after reading about the American Association of Communication, that's why how I connected, and I'm on my journey to learn from you as much as possible. and see how I can implement it in the most valuable way, where I can add value to people's life.
Wonderful. Thank you so much, Dr. Manisha. So whom do you want to pass the baton?
I think Dr. Aparna.
Dr. Aparna, I think your audio is not connected because I can't see that mic sign on your audio. So you'll have to log out and log in once again. When you log in, you have to actually click to the audio, system audio, and then you will be able to connect. I know these are all technology glitches unless you're very comfortable. I think it's getting connected. Let's see. We are not able to hear you. Yes, please speak now. Unmute your device and speak. Is the volume okay? Dr. Aparna, you'll have to log out and log in, I think. Yeah, so by the time you do it, I think we'll request Dr. Kundan to introduce.
Yeah. Good evening to everybody. First of all, thank you, Dr. Indu, for arranging this program in the online format. It is really helpful. I think this program will be really a path changer in my own understanding of healthcare communication. And good evening to all my respected colleagues. I always feel there is nothing happens for without any reason. So we are all here for this program. There is some reason behind it. Let me introduce myself. I'm Dr. Kundan Khamkar. I am a consultant physician and diabetes specialist. I have a diabetic clinic in Pune. Also, I work with a corporate hospital, Ruby Hall Clinic. I always had this passion for healthcare during my rounds and my practice, that there is some lack of communication at right from the medical student level to the patient level. So I think effective and efficient communication is much needed in today's era of diminishing doctor-patient relationship, increased violence to healthcare workers, and dissatisfaction general in society about doctors and medical professionals. So I think effective healthcare communication, I think, is one of the best tool so that we can facilitate this unmet need and overall the gap which is there, which is widening. I also have a passion for legal medicine. I'm also doing legal medicine diploma, and I arrange medico-legal discussions in our physician get-togethers. So medico-legal is another area of passion apart from diabetes. So wonderful. I really am feeling privileged to be part of this program. And let me tell you the meaning of my name. My name is Kundan. Kundan means, I think, pure gold. So that is there. And also request the colleagues over here in the program, they can call me just Kundan. Okay, so that is fine with me. It is easier way to communicate. Okay, thank you very much.
Thank you so much, Dr. Kundan. So whom would you like to pass the baton?
I'd like to pass to Miss Aditi Goyal.
Okay, yes, Aditi, go ahead, please.
Hi, my name is Aditi. The meaning of my name is being limitless. And one more thing I like about my name is a song from that movie Jaane Tu Ya Jaane Na Kabhi Kabhi Aditi. So the reason of me joining this course is to gain knowledge about how to communicate with patients on day-to-day life and how to build a relationship between provider and the patient. So I am an administrator manager of Panchal Hospital, which is an NABH and NABH accredited hospital in Yamuna Vihar, East Delhi. So it's an 80-bedded hospital, and my father is a doctor, my mother is a doctor. So the hospital is our own. So I manage my own hospital.
Wonderful, wonderful. I'm sure you will really benefit from the program, and you will be able to do training.
It's been 3 years now I'm managing the hospital. So I am by profession a lawyer. So I shifted to management in 2020 before the COVID came.
Wonderful.
From 2020, I'm managing the hospital. So I want to learn more about it.
Excellent. Wonderful. Thank you for joining. Thank you. Thank you.
I pass the baton to Santoshi.
Okay. Yes, Dr. Santoshi, please go ahead.
Yeah. Yes, good evening all. Good evening, Dr. Indu. So Once again, like Dr. Indu knows that I'm pursuing for this course from last year, and due to some personal and professional like commitments, I was unable to attend the 7th and 8th batch. But thankfully, as everybody is saying that you are unable to do it, but you got this program in this month, and I was able to enroll for it. So thank you so much for this. So I'm able to do it this time. And as my name is Santoshi Sathe, and the name, as everybody is introducing themselves, especially via their name, and my name is Santoshi, and it's very well explanatory, like it's satisfaction. Like, and my personality is also like that. I'm satisfied with all the things which I have done earlier, and I'm doing it right now, and what is my expectation in future. So it's like a satisfaction, and like संतोष, like सभी चीजों से आप संतोष है आपको. And for that reason only I'm here, because as you know, Dr. Indu, I have shared my profile, like I belong to a pre-hospital care setup where I'm a doctor myself, but from past 13 years, I'm working in an out-of-hospital setup where I work with an emergency medical service providers, like with ambulances. I had 8 years of work experience with Emergency Management and Research Institute, where I was a senior clinical instructor, and I was more into academics, where I used to train paramedics and even ICU and ER doctors and nurses in life support skills. Like I'm a certified American Heart Association instructor for BLS, ACLS, and for PALS program. And as well as I'm an USIM level 1 instructor, where I'm a simulation instructor also. So wherein I have to deal with the adult participants, and that too of various years of experience, and many times senior doctors and senior nurses, where we have to give them feedback. And especially if I call myself as a simulation instructor, then there is a portion known as debriefing, where we have to debrief that why it was done. And so the same is applicable in the field of paramedics, where they are working in out of hospital setup, and where they are carrying patient from out of hospital, and they are taking them en route, and they are depositing or dispatching them to the destination hospital, or pick up from home to hospital, hospital to home, or from between hospital to hospitals. So where I felt that we have a very small fraction of time where we have to take a call, where we have to deliver the care, and we have to transport a patient to the hospital. So wherein I feel that our paramedics are having very limited time, and the kind of feedback we get for that 15 minutes of service or half an hour of service, it more or less depends upon not on the skill, but the way the paramedics or our EMS team is kind of communicating with them. So I just want to help my team in improving the communication, and to get better reviews for their work which they are doing by improving their communication more. So that's the reason I have enrolled for this course. And being an instructor, I feel like I can also incorporate these skills when I am delivering any program.
Absolutely. Thank you, Dr. Santoshi, for wonderful introduction. Whom do you want next to introduce?
Well, to Payal.
Okay. Yes, Payal, go ahead.
Thank you. Yes. Thank you, Santoshi. Am I audible?
Yes, you are.
Yeah. So very good evening, Indu ma'am, and good evening to all of you. So as my name suggests, the Payal is like making a beautiful sound, which everybody likes to hear her. So I'm a physical therapist. I'm the master of sports physiotherapist and the McKinsey credential therapist. And the reason why I want to learn this soft skills is, so as a physiotherapist, you know, we spend a long time with our patients, almost like in 45 minutes to an hour with our patients. So the way what we are trying to communicate with them and what they should understand, I think it's very important. So the whatever things you want to convey to them, it has to be in the right and very proper manner. And along with that, what I feel, so apart from only the professional things, you know, the soft skills is the part of is a huge impact on your personal life too. So yes, I'm really looking forward to have a better and better communication in my both the ways, the professional and the personal. I think my husband has done your few lectures at the HN hospital, and yeah, and I discussed about you. I was so impressed by you that I wanted to join this course with you.
Thank you. Thank you for joining.
Yes.
Dr. Tushar, her husband, I met at Reliance Hospital. I did a program for them, 10 sessions program for them. It was a customized program as per their requirement. And there I happened to meet her husband. Thank you, Payal, for joining. And
Thank you, ma'am.
Yeah. So whom would you like to pass the baton?
To Mamta. Mamta
Okay.
Richard.
Mamta, go ahead, please. Unmute your device.
To Mamta Richard.
Yeah, I think she's Mamta, you unmuted, but you muted again. Yeah.
Yeah. Hi, everyone. Good evening, Dr. Indu. Nice to meet you all. The reason I'm here is Dr. Rao actually suggested me, introduced me to Dr. Indu. So my name is Mamta, which implies the quality, the character. It doesn't relate to any religion. It talks about the quality which everyone gets as a daughter or as a person. And we, especially as a woman, we have that quality to share that love. So yeah, it's an affection. It's moreover the motherly love. Yeah, coming to my academic part, I am postgraduate in nursing. I work in Apollo Med Skills. It's a skilling industry. So we moreover prepare a few online courses, few certified courses, probably for the paramedics and the nurses, working nurses. These are the people whom we train online and also the physical mode. And we develop their communication skills. And I feel it's my privilege to join this program, as I see many people, the great leaders in their respective area. So I think I would be approaching each of you to talk one session at least to my students, of Apollo students, to imply your knowledge, to share your knowledge to them. So yeah, it's like a very honor and privilege to join Dr. Indu. I'm looking forward to work and to practice and to learn more and more during all this program. Thank you.
Thank you so much, Mamta. So who do you want to pass the baton? I think Dr. Aparna, Dr. Sneha, and Dr. Amrit is still left. So Dr. Aparna, is your mic working now? We can request you to.
Hello.
Check. Yes, wonderful.
I am audible now. All right. Good evening, everyone. I am Dr. Aparna Bansal. I am a practicing ophthalmologist, practicing since 23 years in Navi Mumbai, Maharashtra. And my name as such doesn't have any meaning as such. It's the name of Parvati, basically. So, it is doesn't have any particular this thing. But what I have faced in my life is basically what I always felt was in our scientific process, learning process. We never were taught about the communication skill part, and that is something we were lacking in the healthcare industry as being part of a doctor. But now my daughter is studying MBBS, and now she tells me that they are being taught. There are a few sessions they are taking about so there is some change in the MBBS curriculum now that they have introduced, and it is a very good thing. So I thought I got this great opportunity to learn from Dr. Indu and everybody else. So I thought of joining this, ma'am.
Thank you so much, Dr. Aparna. Thank you for joining the program. So Dr. Amrit and Dr. Deepika is also left. I think after Dr. Amrit, we can request Dr. Deepika and one more person, Dr. Sneha. Yeah. Dr. Amrit, is your mic working now? We are not able to hear you. So by the time you fix up, can I request Dr. Deepika to introduce herself?
Am I audible now?
Oh, yes. Go ahead.
Okay. Yeah. Good evening, everybody.
Loud and clear.
Thank you so much. I am Dr. Amrit Kaur, and I am a homeopath in the group of mostly allopaths here. And I was introduced to this course and to Dr. Indu by my very close and very old friend, Dr. Neha Agarwal. We know each other for a very long time. And I and Dr. Neha have conducted a few courses in BLS together. So we always knew the importance of communication in our field. And as we both are practicing, so it is always, I mean, we always know how communication is important, how we need to improvise and improve upon it all the time. So I have been practicing for last about 30 years. I have been associated with the two colleges as professor HOD, and I have worked with Max Hospital for 2 years, and have been associated worked with I have worked with other hospitals also, and this is all, and I'm looking forward to learning a lot from everyone here and from this course, and see that idea is to improve my skill set. And especially in homeopathy, we take a very, very detailed history to reach a remedy for the person, because we have tailor-made medicines. No one medicine fits all thing is in homeopathy. We have to find a medicine for everybody after individualizing. So communication is all the more important. What is being told and how we are following it, how we are getting it, that is the basis of having a good practice in our field.
Absolutely. Yes, I agree. Homeopathy has a huge component of communication.
Yes.
A lot of emphasis is put on history collection, details collection. I agree.
Yes.
Thank you. Yes. Thank you. So whom do you want to pass the baton? There are two people now, Deepika and Sneha.
Deepika ji is fine. I can pass it on to Deepika ji. Yeah.
Thank you, Dr. Amit. Very good evening to everyone. So I am Dr. Deepika Tyagarajan. Deepika means light. So I think it translates to Deebam. So generally people call me the bubbly person. So I like to spread positivity and light. So I hope I do the same with this session as well. And I am a dentist basically, and I did my MBA in healthcare management. And I have done or taken up a lot of roles in quality as well as operations in my experience. I currently stay in Qatar, so I've got an opportunity to work in the government sector. So I'm working in Primary Healthcare Corporation, Government of Qatar. And I'm into the Department of Licensing, and currently I'm not practicing dentistry. So, but I've taken up the administrative path, which I'm really enjoying. So I think I already enrolled to this course. So I wanted to thank Dr. Indu for re-inviting me for this course, because I was part of the master batch I think it was sixth batch, but unfortunately due to various commitments, other commitments and stuff and professional reasons, I was not able to complete my course at that time. But I really look forward to this course because I've read a lot of positive comments and reviews in LinkedIn. And I'm so happy that we are all here today to start the journey again. So thank you, Dr. Indu, and I'm looking forward for this new learning. Thanks.
Yes, Dr. Sneha.
Good evening, everyone. I'm Dr. Sneha. I'm from Hyderabad, and I'm a pediatrician, and I also specialize in lactation services. I'm an assistant professor in a government setup, and my name means friendship and affection. And though we have joined, many of us have joined the healthcare for that human connection. No, in our regular course, it has not been taught. It has been left to our role models and to our own devices to figure out how to communicate. And communication, we all know, is so important in that small, brief period of time, not just to because the parents or the patient cannot really gauge your medical knowledge or your expertise. They remember how they are made to feel rather than your expertise. They only understand how they feel about themselves when you are interacting with you, and how they feel you care about them. And their compliance also depends a lot about how they feel you care about them. So I have realized that in a fast paced in a busy environment, it becomes a challenge to come to show that empathy, to show that care, even though you have it in your heart, to translate it and to make the patient actually feel that you do care about them, especially when you are pressed for time and there are too many things in an emergency setup. And because I am a medical faculty, I want to be a good role model for my postgraduates, because I struggle to have good role models. I only saw looking down upon or patronizing comments from my faculty, and it used to make me cringe. I didn't want to be like that, but subconsciously I also end up doing that. So it took a lot of time to undo it, but I want to be better, and I want to really, be a good communicator, so that my patients feel good and I also feel good at the end of the day, because otherwise there is that, because there's lack of connection, it's so easy to get burnt out. And I think it translates into general life also. When you learn something in your healthcare communications, throughout the small steps I have made in the healthcare communications, I've seen things change with my own child, with my own partner, in my own social circle. Communications have improved. So I just hope it translates to all areas of my life.
Thank you, Dr. Sneha. I think you really highlighted the importance of communication, not only for the patients but also with the fellow workers. Thank you. So we have two members missing today. One, she informed me beforehand because she had a mishappening in the family, so she said she's not able to join. Dr. Amrit, your other device is on. Please, can you mute that device, because we are able to hear some background. Yeah, thank you so much. Yeah, but one of the participant hasn't joined. I hope she has seen the message and she is not knowing that we have started the meeting, but I'll check after the session is over. So thank you so much, all of you, for introducing yourself. It's a pleasure, having people from diverse backgrounds. So I'm sure it will be rich learning. We'll get to know each other. We'll get to see things from others' perspective. A lot of our confusion and our assumptions will get clarified when we will interact and meet with each other. At the same time, what I want to request all of you is to remember that we are all here to learn. So keep that in the mind, and then I'm sure we will make sure that we create more and more opportunities for each one of us to learn. So before moving further, I have shared a link in the chat box, and it's more like a pre-program assessment. Please open the link and see if you're able to work on the link, use the link. It will take you 5 minutes, but we need to complete this before the program so that we have an idea where we stand now and what are we looking for. Let me know if you're not able to. Meanwhile, I'll make a call to the other doctor who has not joined. See if she can join back. Yeah. Dr. Sneha, do you want me to resend the link because you joined once again?
Dr. Indu, I just cannot, I mean, somehow everything has got minimized. I don't know what has happened.
Dr. Amrit, आप अच्छा एक बार लॉग आउट करके लॉग इन कर लो, बट आपने कंप्लीट कर लिया है अपना फॉर्म?
Even I'm not able to do it. In fact, it's got stuck.
Is it? I have received 6 responses. Dr. Amrit, I
Actually, my Dr. Neha here, Dr. Indu, if you can hear me, my whole system has, I mean, I cannot see anything and I don't know what has happened. So,
see, you will have to slide the screen, because if you have opened a document, then maybe the Zoom will go on the other screen. So which laptop are you using?
MacBook. So now I have got the screen back.
Yeah,
that's the thing.
We
But
can
now,
see you.
yeah,
We can
so
definitely see you.
now I will click on this. Yeah.
Yeah. Do you want me to send the
So,
link in the group, in the WhatsApp group?
yeah, now I have yes, opened
Submitted?
the link. Yeah.
Yeah. Okay.
Okay.
Please, yeah. So, Dr. Sneha, are you able to open the link?
Yeah, I filled the form. I have filled the form.
Okay, thank you. Okay.
Yeah.
I can see your name. Yeah. So those who have completed can write completed in the chat box so that we know who all have completed. So who all are still working on the form? Please raise your hand so that I know.
I'm working. I'm working.
We'll wait for you for a minute. Yeah.
Indu ma'am, I've submitted. Dr.
Okay.
Manisha this side, I have submitted.
Okay, thank you, ma'am. Thank you. So one request to all of you to keep taking tea, water, coffee, something that you want to take during this session, because I know it's 2 long hours and after the whole day, it's very difficult to sit like this. So you feel free to have tea, coffee, juice, water, whatever you want to take. Eatable can be avoided, but otherwise I think the rest of the things should be okay. Yeah. Okay, so I think all have completed, or Dr. Neha, you are left, I think, no?
Yeah, just because I started very late. So this
It's
is
all right. It's all right.
Dr. Indu, I want to say something. Actually, because I have never been in this, I think people, most of my friends here are from MBA, they have done their MBAs and have been associated with administration and all. But I haven't been, and I am a pure clinician. So the few of the terms I might not actually be understanding well. So just to say, this is something new for me.
Please ask. If you don't understand anything, don't hesitate. Feel comfortable and ask.
I will definitely ask. Yeah, I will definitely ask. Just to say that, because these are many of the terms are going to be very new for me. I haven't heard them earlier.
It's all right. Don't worry. Absolutely.
Yeah, I'm here to learn, and I'm sure I will.
Thank you. Thank you.
Thank you.
So by the time Dr. Neha completes, let me give you a brief overview of the program. Is that okay, Dr. Neha? Or will it be challenging?
Yeah, that's fine. That's fine. Yeah, no, that's fine.
So I want to tell you that this program has been designed in a very unique manner. How many of you had a look at the list of the topics? Okay. What did you find different or something that brought a question to your mind?
It's all about the communicating part, ma'am. How in different situations, how to communicate, how to handle, how to manage, how to organize. These are the main things which I found, ma'am.
So I think one clarity we all should have, that this is not just about soft skills, because you have been repeatedly using this word soft skill. Actually, when you will attend these sessions, you will know it's not soft skill, it is clinical skills. It is therapeutic communication that you have with your patient. But of course, when we will be in the topic, we'll talk about it more. What other observation?
Like it is more realistic, more realistic case-based discussions, and as per that, how to communicate with the patient. Like the role plays are there, as you said, demonstrations will be there. So I feel that those will be including the actual scenarios which you have came across during your whole experience. So you have incorporated that in the training. So which make this training little different from the other communication sessions that we usually have in companies or in hospitals.
Absolutely. So role plays that we are going to do are going to be picked up from your life experiences, because ultimately I want to equip you with these skills to deal with those situations. So you will be coming up with the situation, and in case if you don't have a situation, then I will offer you a situation. But I'm sure each one of us will have some situation in mind where you had difficulty communicating, or you saw somebody struggling with communication, and we can take that situation as a role play. Yes, role play is a big base of this program. Thank you for pointing on that, Dr. Santoshi. What do others say? What is your
the list is quite good and exhaustive, and I think it covers almost all the topics that we are looking forward to learn from you and everybody else. And there are a few things which may not even have thought about, whether our communication skills are better in that area. I think we will be more aware of those things now once we go through the program, and it will make us aware, okay, this is the way we should be communicating. So I think that will make us a little better communicator in that sense.
Thank you. So I have tried to at least cover very important salient topics that I think we come across every day and we are not trained into it. So it's really good idea to know about that topic, understand the protocols, and learn by doing some role plays and some activities. Thank you for that observation. Any other observation?
Ma'am, the topics are varied, where one of the topic is how to break the bad news. Then there is self-introspection, like when we teach communication to either my staff or to my doctors or to the administrative people, it is not to tell them to do that. It is to make them realize that how they can be more effective, how they can answer in a way which is therapeutic, as you said, and where it is the person is perceiving it in a positive manner. So, for example, there are different types of treatment. There can be, if a patient comes for surgery, so there is a classical surgery, then there is a laparoscopic surgery, and there is a robotic surgery. Now we can't just jump on and say that I tell you to take robotic surgery. So how to convey this, that these are the three ways where the surgery can take place, and this is the pros of this surgeries and the cons of this. This is the pros and this is the cons, this is the pro. And now this is the economic status, that is the financial counseling part. And this, so that a patient is able to make informed decision. So how a consultant is able to help their patient make informed decision is also a part of his clinical practice.
So we are going to cover various topics, especially breaking bad news, disclosure of medical error, or any complication which patient might view as an error, but we got to explain to the patient and make them understand that this is part and parcel of the treatment. So those are very difficult communication, and we should know how to do it. We should know the protocol of doing it. We are going to learn all that through activities and role plays, definitely. Any other observation about the list of topics? Yes, Dr. Kundan, go ahead. Please unmute your device.
It is a very comprehensive list of topics, but I think what struck me most was about the handling aggressive patients, because almost every industry is taught about handling aggressive customers, hostile customers, even the airline industry. But somehow this was lacking in our medical curriculum, or this never came up, that aggressive patients and aggressive attendant. So that I think is really very much one of the key highlighting. Of course, the list is more exhaustive and comprehensive, but that part I think is lacking in because as a practicing clinician for so many years, I find that is today's 2023, where people have different expectations, different mood, and different social strata. What I must say, the different moral standards in the society. So it is percolating to our patient is no alien to that. A patient comes from the community, from the society, and even we come from the society. So handling that aggressive behavior or reaction, I think, goes a very important to prevent many medico-legal mishaps later on, violence later on. And I think is a highlight of that program amongst all the other comprehensive list.
Absolutely. Thank you so much. Thank you. So did you read topic 3 and 4? And anybody who would like to share their thoughts, those who have not spoken, I would request them to give their thoughts. Topic 3 and 4. What is it about? You don't have the list of topics in front of you?
It's benefits of effective communication and principles of communication.
Designing a training program.
Yeah. Topic 3 is designing a successful training program. And topic 4 is how do you facilitate a program? So these 2 sessions are not just about communication, but they are about, if you want to train people, what all you have to keep in mind. So topic 1 and 2 is going to be making a baseline for what communication is all about, how it is similar and different from our day-to-day communication, and what are the benefits of communication. Second topic is going to be about understanding the nitty-gritties of communication, nuances of communication. But 3 and 4, I have deliberately kept in the program because if I want to help you become a trainer, then you need to know what I keep in mind when I'm designing a program. And then how do I conduct a successful program, impactful program? So a lot of emphasis you will see in this program, we are going to give on your training skills. So if I may say, the whole program is focusing on 3 major areas. One is content. Of course, I've given you the soft copy of the material, and we are going to have these topics covered by me. So we will be having a lot of discussion on these topics. Second is about facilitation skills. So we are going to learn how to facilitate a program. Most of us just know about using PPT and just lecturing, but we know with the adult audience that is not working. We really need to engage the audience. But for 2 hours, if you have to speak to your audience, and that too also online, and if you're just showing them a slide and making them listen, half of them will switch off their cameras and they'll start doing their work. They'll say, it's okay, I've taken the screenshot of the PPT, I can see it later. But that's not something that you have to do. So we are going to pay a lot of attention to it. And third part, which is very beautiful, is practice. So how I have incorporated practice into this program is that after I will cover topic 4, that is how to facilitate a successful program. After topic 4, I will be sharing a list of different pedagogies, storytelling, PPT, video, or ice-breaking activities, or how do you introduce a topic? Something like there are 10, 15 topics that I'll be sharing. Each one of you will be picking up one topic of your choice. So as early as possible, identify the topic that you want to speak on, and you will be making a presentation for 10 minutes on that topic. So if, for example, if you choose storytelling as your topic of choice, then you will first give us a short story for a minute or 2, and then you will talk about how storytelling can be used as an impactful pedagogy in adult learning and teaching. And then what are the advantages and disadvantages, do's and don'ts. Just 5-6 slides, not a very big thing, just 5-6 slides. And then you will make a presentation. So 1, we will learn how to present our topic. Of course, most of you are already into training, but it will be learning new, pedagogies. And that way, when all of you will make presentation on one or the other topic, we all will learn almost like 10 to 15 new pedagogies. Even about PPT, you may be using PPT. How many of us really know how to make an impactful presentation? What are the things to keep in mind? What should be the font size? How many lines should be there? How many slides should be there in the presentation? So all that, who will talk about PPT will let us know. So that way we learn from each other, and that way we will have a lot of learning about the pedagogies also. So that's why, as I said, the whole program has been planned in this manner that up to session 4, we will cover 4 major topics. And after that, session 5 onwards, we will cover one topic. And towards the end, we will have 30 minutes reserved for 3 speakers, 3 or 2 speakers, depending upon how many people we have, total. Maybe two will also be all right. And we'll reserve 20 minutes in the end to give to those speakers who will present their presentation. So that's about the format of the. Any topic that you think should be changed or you don't want, because it's your program, so you're free to give your opinion. Any topic
as the program progresses, I think we'll be able to answer it better if we feel that this is the changes needed. At present, I am not able to guess.
By then, I would have covered the topic. I think it should be fine, because I have asked this question a lot of time to all other previous batches. Most of them have been very happy with the list of topics that we have designed. So hopefully it should be fine for all of us. The format will be, we'll be doing role plays.
I think, Madam,
yeah. Go ahead, please.
I was just going to say one thing. There is something wrong with my system. I am not able to see the things, and that's why I could not put the, there's only a small, it has gone into a small square. That is a 1-inch square, and it is not getting corrected.
So you need to maybe either log out, or if there is
I tried to do that also, but that's why I was not able to focus also what was happening, and I did that, but it's not happening again.
Ma'am, you can exit and come back, no problem.
Okay.
Log out and log in, it's all right. I'll take you
into.
Okay. Dr. Indu, please, can I know where this list of topics is? Because I am not able to see it.
Ma'am, I sent you the first email.
That booklet?
No.
Okay.
First email that I sent you, I mentioned the list of topics, and these are the topics we are going to cover.
Okay, sorry. I'll just go through it, and I think I'll be able to
topic once again in the group if you want. I can share it in the WhatsApp.
No. Okay, sure. Thank you so much.
Okay. So till now, any question, any thoughts that you want to share or comment or say? Okay, no problem. So moving forward, we're going to talk about today's topic. And the topic of the discussion is, what is the importance and relevance of communication in healthcare? Most of us think that it's soft skill, but it's going to be an eye-opening experience for you when we'll talk about it. How it's not just soft skills, but there's much more than that. You all have been in healthcare for so many years. If I may ask all of you, what has changed over the last couple of decades? I ask you to write in the chat box so that each one of you can share your thoughts. What do you think has changed in the last couple of years? What has changed? I think Dr. Priya joined us. Dr. Priya, can you have your video on? Because we couldn't have your introduction and we could not see you and meet you.
Hello. Hi everybody. Hi, ma'am.
Hi, Dr. Priya.
Actually, I ended up having a very bad sprain, so I was
Oh,
fixing that. I'm fine now. I'm fine now. So managed to join in.
So are you comfortable having your camera on, or you want to keep it off?
I'm okay. I'm comfortable, ma'am.
Thank you. Thank you. Thank you. And we will very shortly ask you to introduce yourself, because all of us have introduced. So we'd love to have your introduction. But right now, I request everyone to focus on the question, what has changed? I can see some answers in the chat box. Payal says, patients are too much impatient and less trust on doctors. Agreed. Demanding patients? Yes, I agree. No doubt. Patients are demanding. Uh, Awareness of health in public? Yes, people are becoming more aware, especially they have Google on their hand, just a click of button. And trust me, more than Google, Chat GPT is going to blow everything out, even the Google. So be ready for that. Rather than being unhappy, let's accept it, embrace it. Doctor-patient relationship has changed. Dr. Manish, I completely agree with you. I think this is something which is really a matter of concern for all of us. Too much half knowledge, more anxious, less trust. Agreed, but that's something not in your control or in my control. Then Dr. Kundan says, explosion of information technology, increased expectation from patient and caregivers, degrading doctor-patient relationship. Again, I fully agree. This is true, but how much of it can I control and how much of it can you control? That's something not in our control. Demanding patients, yes, Mamta, I agree with you. Dr. Santoshi says more advanced technology leading high expectation in care. Absolutely. Expectations and attitude towards doctor. Yes, Dr. Aparna, things are really changing. They're going downside. That's really worrisome. Yes, patient expectation, technology. Yes, Dr. Deepika, I agree. Expectations are increasing. New emerging diseases. Yes, COVID-19 has really changed the definition of infections and chest infections. More complex healthcare and more diseases, more treatment. Absolutely, I think all of you are right. Dr. Neha has written more medical legal issues. Yes, that's alarming. That needs attention. And over the decades, patient and family have become more aware of healthcare system, lost the trust. They trust Google and have become more aggressive. I completely agree with you. I completely agree with you. So I think one announcement that I want to make here, see, when I ask you to list down the issues, and if we look at the issues that everybody has shared, we can actually put these issues in two broad categories. Make two circles in your copy. I hope you have a copy and a pen with you. Please keep a notebook with you, because if you will not note down, you will forget within 24 hours. So make a separate notebook or a diary for this program. You can take a couple of seconds to bring your notebook in case if you don't have it now. It's all right, I know. I should have mentioned in the email. Yes, more dependent on technology for new doctors. I believe. Competition among providers have become more intense. Yes, Deepika, I agree. I understand your plight, I can say. I know. I think this was one area where we didn't have to have any competition. Unfortunately, we have gone on the wrong side. That's sad. Okay, so make two big circles, one bigger one and one smaller one. Take few seconds from the list that everybody has shared. Put that list in, divide that list into two circles. The first circle is things over which you have direct control. Write on that. And in the right side, a smaller circle, things over which you have some control, or you can influence, or you can bring some change. Is my task clear? Am I making sense? Draw two circles, one bigger one, one smaller one. In the bigger circle, you will have the things over which you don't have any control. They are true. They are true. I agree. They'll go in this circle. But there are things over which I have control, and that will go into the smaller circle. Once you have done, write done in the chat box. This exercise is going to ease your stress. Is going to release all the pressure that we all experience being in healthcare. I can see 3 of you have done. I'm waiting for everybody to write down in the chat box. If there are a couple of things repeated, you need not copy them again. Also, if you have put in, say, 5 items each, even that is okay, because idea is you need to understand the concept. Seven of you have done already. Mhm. 9 people have done it. Mhm. Sorry, I'm taking it for my sore throat. So the bigger circle, which has things that you don't have any direct control. Can you tell me what all you have written in that? Just one thing, one person. And don't repeat. Unmute, speak one thing, one person. Let others also.
My own knowledge of the subject that I am practicing, or the services that I'm giving, I have control over it, in the sense that I can improvise all the time.
So that means this is in the smaller circle, things over which you have control. Wonderful.
Yeah.
Next.
Yeah.
Yes, Dr.
Expectations of the patient.
Okay. Do you have any control over it?
No.
Which circle will it go?
Left circle.
Yes. Bigger one. Usually that
Bigger
will be
circle.
wonderful. Yeah. Next.
Technology, changing technology day by day.
Wonderful. Changing technology, emerging technology. Do you have any direct control over it?
No.
No.
This again goes to the circle where we don't have any control. Next.
Health standards. Health standards.
Health standards. Do you have any direct control over it?
Sometimes no.
Yes, and sometimes yes. At least in your own work area, you have the ability to create health standards in your own capacity. So maybe we can put this into the smaller circle. Dr. Manisha.
Ma'am, in the bigger circle, I have put the explosion of internet knowledge.
Knowledge bombardment.
Is in the bigger circle, which I don't have control.
Yes.
But my responses to the patient towards that knowledge is under my control.
Excellent. Very good. Very good. Yes, Dr. Kundan, go ahead, please.
No control over government policies. But yes, fighting for the cause under our control.
Wonderful. Excellent. I think that's a very good explanation of both the things. Priya, what have you written?
Actually answered by everybody, so it kind of repeats. So not under my control comes as expectations, too much of knowledge.
Chalo, under control bata do. What is under your control?
Under my control is the care that I can provide to patient.
Our own behavior, our own conduct, our own actions. Wonderful. What do you say, Sneha?
I think the initial trust is not under our control, but as our relationship progresses, the patient-doctor trust relationship is definitely under our control.
So, Sneha, if I may add, patient may come with an assumption.
Yeah,
but my behavior,
that is not under one.
But with my behavior, I can change it. Because I have to have that, that I can do it. I can change it. Thank you for that.
Yeah.
Santosh, what is your opinion?
Yeah.
The things which we cannot control is like one of us has written that healthcare viewed as a commodity. And one more thing, that the advent of new diseases, new viruses are coming up. So we cannot control them. And which we can control is expectation and attitude of patient towards doctor, by good behavior, by good communication. And as Dr. Sneha said, that initially maybe there can be trust issues, but later on, as like more interaction is there, more communication is there, so those things can be controlled. Like we can change the attitude and expectation of a patient.
Absolutely, spot on.
During the process of care. Yeah.
Anybody else who would like to share their list that is not covered? Anything that you have? Yeah, please go ahead. If anything is not.
Yeah, one thing, just about the when we say medico-legal issues. So by our communication skills, our behavior, how we deal with the patients, we can have some control over it if we really take care of that.
Absolutely. So how many of you have heard of this concept? Has anybody heard of this concept? What I've shared with you? It's a beautiful concept shared by Stephen Covey. It's a beautiful concept shared by
Circle
Stephen
of influence.
Yes, thank you, Sneha. So there are two circles. One is circle of concern and second is circle of influence. Everything which is true but you don't have any control will go into circle of concern. Yes, you know, it's really worrisome, bothersome, but I don't have any direct control. But there's a smaller circle which will have things over which you have control or you can influence, and that's called circle of influence. So from today onwards, I will advise you, whenever a problem comes, think, can I do anything about it? And if you think, yes, I can do. There's a patient who is aggressive. There's a patient who is dissatisfied. There's a patient who is complaining. Ask yourself, can I do something about it? Yes, this will go into circle of influence. It's raining outside. Can I do anything about it? That will go into circle of concern. But I need to go out. It's very urgent. What can I do? I can use umbrella.
I can still go. I can still go. Yeah.
Make some alternate and proceed.
Maybe I can take umbrella, I can take raincoat, but I can take an action. So very smartly focus all your attention, energy, and time to circle of influence. If you want to bring change in this society, in this system, in healthcare, you have to very mindfully focus on only and only circle of influence. You will find people will keep crying and cribbing about system, about culture, about wrong notions people have, or public, or society. What result will that bring, even if you discuss those issues for days and weeks and months? No. But if you decide to take some action, do something at your end. So when I started this program, not training doctors and trainers, but when I started working with the hospitals as a trainer, so there I always used to get this comment, nobody is going to listen to you. Nobody is going to understand this and agree with this. I said, that's their choice, but I can make my effort. And there I am in front of you. So if you just give your total 100% attention to something, you can definitely bring a change. So first thing that I want to say, that if you focus your time and energy on something that is doable, you will definitely be able to make a change. And change may be very, very small. You may say, I can't see the difference. How many of you have read this book, Atomic Habits? Has anybody read Atomic Habits? Anybody? Areva, Sneha?
I am reading it. Yeah, I'm reading it. I'm in the process.
Thank you. Wonderful. Everybody should read it.
Yes, it's an amazing
Beautiful
book.
message from this book is, even if you work 1% every day, just 1%.
Yeah, it will make a great change. Yeah, it will make a great change in the long run.
Absolutely. So just make 1% of addition to what you are doing today. In the end of 1 year, you will be 37% different from what you are today. And 37%.
Ma'am,
Yes.
there is a saying by one of the renowned educationist, Japanese educationist, Ikeda Sensei, who started the peace movement. He says, drop by drop the ocean, you make an ocean. So it is by every action of yours that you bring the change. It is not that you have done once and if you are denied, you stop it. So every time you will try, you will succeed.
Absolutely. I completely agree with you. And I think that's what we are trying to do. Whatever has gone wrong, we want to correct it. We want to make it better by learning new skills and upgrading ourselves. Okay. So the topic of today's discussion is about the importance and relevance of communication. And we all know this was something we never talked maybe 10, 20 years ago. Nobody talked about it. But today, I think this is one of the hottest topic of discussion. I just put my, that is Medflix. Yeah, Medflix approached me to do a session for them. And I saw 200 people have already registered for that session. That means people are now getting interested into these topics because they know this is something that we have to learn. Practice of medicine was very, very simple and easier. But over the time, things have changed drastically. A lot of changes have happened. You have already listed the topic. But we can't sit and cry that these changes are not acceptable. We have to gear up and change and become better so that we are able to cope up with this situation. So let me share the presentation with you, which has a couple of points to share with you. And again, I'll have some questions to ask you. Give me a second to share the presentation with you. Oh my goodness, have I closed the whole thing? I think I have closed the whole thing. Give me a second, please. God. Are you able to see this slide? First slide? Okay, thank you. So as I said, practice of medicine was far more easier and simpler. Patients had a lot of faith. We didn't have to worry much, but things have changed. We have already listed some of the changes that we have seen in the society happening around us. I think it's time that we sit and think what we need to change. I think one of them is our communication with the patient. We need to really take it seriously if you want to change the situation. Now, let's see what do studies suggest, because that will give us an idea what is the existing practice right now. So this is a study by Institute of Medicine that has identified that clinicians and other healthcare professionals lack adequate communication skill training. We do not have, and you have all already mentioned that we were never given any formal training. We were just left to our role models. And unless we had good role models, we didn't learn the right way of communicating. The reality is that most of us have not learned it formally. So there's another study by Tong and al. They interviewed orthopedic surgeon. They surveyed orthopedic surgeon, and among them, 75% of them believed that they communicated satisfactorily. So when the same thing was asked to their patients, only 21% of the patients agreed to the orthopedician's point of view that yes, we were given complete or enough communication. Okay. Studies also suggest that we interrupt our patients frequently when they start talking. Any idea? And how much time do we interrupt our patient?
Mostly less
Few
than a minute.
seconds.
How many
Less
seconds?
than a minute mostly.
Less than a minute. Actually, few seconds. Actually, few seconds. So a couple of studies suggest that we interrupt our patients within 10 to 15 seconds. Imagine the patient has come to you, he or she has waited outside for say half an hour, 45 minutes, and if it's a government setup, maybe for 2 hours. And they've come and they've started speaking about their problem. And within a couple of seconds, we interrupt them and we stop them and we start asking them leading questions.
Can't hear you, Dr. Indu.
Is it? Am I not audible? Who is not able to hear me? Please name. I'm not able to. Please tell your name. Who is not able to read?
I can hear you.
So maybe then the network problem is at your end, my dear. Although I don't know who was speaking, but it could be that these are. So maybe in between, if you switch off your video for a couple of seconds, it will improve. So as I said, that we interrupt the patient within few seconds. We don't allow the patient to speak about their problem and we start asking questions to find out their problem. Any idea why do we do that? Why do we do that? Why don't we allow them to speak?
Time.
We feel
We are
Shortness of
impatient,
time.
basically.
Impatience, shortness of time.
Okay, impatience.
We are afraid they'll ramble and they might go and deviate.
Absolutely right. So most of us think that they will take a long time to speak. So let me ask direct questions and complete it. Any idea if you don't stop them, in how much time they can actually talk about their problem and then stop? Guess.
30 minutes.
60 seconds.
If they'll
50 to
speak,
60
keep
seconds.
speaking.
Most of the patients are able to complete what they want to say within 80 seconds. They stop speaking after 80 seconds. Yes, there are some patients who take much longer, who would not come straight to the problem. I don't disagree with that. But most of the patients are able to talk about their problem within a short span of time. And if you allow them to talk about this problem, they go back very satisfied because they have a feeling that this doctor has heard me. Now, what do Indian studies suggest? It's important to understand. No, this is not an Indian study. This is again a foreign study. Studies also suggest that we do not practice the basic standards of informed decision making. We decide on the patient's behalf, or we push a particular treatment modality which we think will suit the patient, but we don't, share complete information with the patient. Why don't we do that? Why do we push one strategy that we think will suit the patient? Any idea?
We feel they don't have enough
Maybe.
knowledge or emotional maturity,
To decide.
emotional coolness in that point of time to make the right decision.
Absolutely, absolutely. What do others say?
Like Dr. Indu here, too much of Google studies. So
Yeah.
we feel that many of the symptoms or the signs which they are quoting here, especially symptoms, after going so many literatures and half knowledge. So we feel that better not to involve them in deciding the treatment modality, and we ourselves, we feel that maybe this modality is good for them.
So if they don't know something, and if you shared information in a proper manner, do you think that will be better? Or we just decide and then tomorrow when decision and the action does not go in their favor, who bears the blunt of the outcome?
No, we can give them multiple options, like treatment options, and give the pros and cons of all the treatment options that are available, and make a show empathy towards them, so that we it's like we have to show them that we are on their side. It's not that we are on the other side of the table. We are on their side, and we are together with them, and we are going to decide what is best for them.
So you can see it here.
I think
those of us who believe. Yeah, go ahead, please.
Yeah, conventionally, we are always taking that part. We think as physicians or clinicians that we only are there to tell them that this is to be done. We don't want to accept it even now that the other person can also make the decision. When now so much is attached to that making of decision, medical legal aspects, and so many things. So somewhere we are not able to right now accommodate the patient's view in our decision making yet.
So we are,
I don't know.
So we are so used to deciding on the patient's behalf that we think if we share information, it will take a long time. If we share information, they will get confused. If we share all information, they might run away. So we think, okay, let me decide on the patient's behalf and tell them this is the best option and not talk of other options. And then finally tomorrow, if that option does not work out, then you are blamed for not informing them complete information. So those of us who think shared decision making is okay, they think it can be used in every situation. Only thing is you need to simplify, you need to choose what needs to be shared, and at least answering patients' concern, clarifying their doubts, giving them at least most important information. But some of us who think that no, you can't practice shared decision making in all situations, we choose to decide on the patient's behalf. But you have to take.
Yeah, ma'am. One to add.
Can I share one thing?
Yeah. Give me a second.
Providing right information at right time is much appreciated, though it is not in their favor. But yeah, correct time, proper information, if it be shared, it is much appreciated.
But studies suggest that we do not follow this protocol very meticulously. I agree with you. Even intense communications like breaking of bad news or prognosticating or disclosure of medical error, studies suggest that almost 2/3 of the patients and the families felt that their experience was suboptimal. Either the physician was too blunt, did not know how to say it, did not choose the right place or time, or even sometimes they got the sense that there is no hope and they wanted the physician to be more sensitive. Although you need to honestly come out with the reality, but at the same time, you have to balance between the two. Now, what is the situation in our country? So this is a recent survey that I'm sharing with you. 45% of the families have reported feeling unempowered. They perceived a lack of involvement in deciding the treatment. Either it was a rushed consultation, or they did not get enough information, or they were not involved in decision making. Almost 32% of the patients and their family members felt that the attending doctor did not straight away address their questions and concerns. Because we think if patient asks more than 1, 2, or 3 questions, we start feeling impatient. We think this patient has read on Google, so this patient is asking a lot of questions. And we are not used to that. We are not used to the idea where patients would question something or ask something. But with the changing time, with so much of finances involved in the treatment, do you think anybody will agree for a treatment modality without understanding the nuances of that procedure or action? But studies suggest that we are not comfortable talking about this. Now, if I may ask you, if we learned communication, how personally do you think individually you will be helped? Write in the chat box. What are the benefits of learning communication for you as a person? Write in the chat box. Wonderful. Improving interpersonal relationship. Convey things in a proper manner with clarity and constructively. Absolutely. Better patient satisfaction, definitely, and also leading to more patients coming your way. Absolutely. Giving best of my knowledge in best interest of the patient. Yes, I agree with you. Then immense benefit if I'm able to convince the patient for better care. Absolutely, Dr. Aparna. And it's both benefit for the patient as well as for the treating doctor or the healthcare provider to communicate clearly. More holistic practice. Absolutely, this is an important thing. Then ensure patient is well informed and pros and cons, so that patient does not blame you tomorrow to keeping him or her in dark. Yes, trust building. I agree with you, Amrit, because if you are able to talk to your patient, answer their questions, most of them will go back satisfied and they come back to you. I remember I sent a cousin of mine who had to undergo hysterosalpingiography. I'm talking about quite long ago, but I just remember this incident. And she had gone to a couple of gynecologists for it. So I sent her to a friend of mine who is a good gynecologist. She and her husband asked a lot of questions, to the extent that till in the end, her husband said, "I'm really sorry, doctor, I have asked you a lot of questions. You must be really upset with me." And her polite answer was, "It's perfectly all right. It's my duty to answer your questions." Patient got the procedure done the next day. So building trust comes with if you are able to answer their questions confidently and honestly. Better
Dr.
patient outcome.
Indu,
Yes.
yeah, sorry to interrupt. I get a lot of such patients, infertility patients, I get a lot of them. And this is a very regular thing that comes my way, where people are advised to go in for HSG. And the simplest thing is the doctors fail to communicate to the patient that it is a painful procedure. They don't tell the patient. The patients are so unnerved, they are so disturbed when they come and tell it was so painful. Why is it so difficult for somebody to tell it in a simple word that expect at least this much? The person goes, maybe I will not be having any pain. And if the person is going for this painful a procedure, at least some pre-information is required.
Absolutely, I agree with you. Thank you. Thank you. Although I could not see who was answering. Is that Dr. Amrit? Who was answering?
Yeah, this is Dr. Amrit. Yeah, this is Dr. Amrit.
I think your video is off, so I'm not able to see you. That's the problem. So I could not identify who is speaking.
Now I think it is on.
Okay, thank you. So honestly, I mean, you have all given wonderful answers. So bad news on treatment aspect can be communicated with empathy, and that helps in making the patient and family accept it. Better compliance, like Dr. Sneha has said, absolutely agree. Convey things effectively for benefit of the patient, absolutely. And benefit of learning healthcare communication will help in coping mechanisms and managing own personal stress that may come out in a hostile patient experience. Absolutely. I think you have covered almost everything. So I'll not spend much time on it. Couple of points that we have not covered, we'll look at it. Actually, effective communication will reduce medical errors. Any idea what is the rate of medical errors in across the world? How many deaths happen because of medical errors?
Third most common cause of death.
Imagine. I don't know how many of you really know. Actually, according to JCI, medical errors are the third commonest cause of deaths in US. We have not done any study in our country. I don't know if we did, where we will stand. You can tell me better. You can tell me better. But yes, we all know most of these errors are because of poor communication. When a doctor has not communicated to the nurse, or the nurse has not communicated to the doctor, there's communication gap. And especially most of the errors happen during transition of care. So when you transfer one patient from one care area to another, that complete information gets lost in the process. Most of the errors happen in the transition of care. Medical errors like wrong site surgery, wrong medication, wrong organ removal, wrong treatment, wrong patient, these are very common. Some of us may think, no, that's not common. Only thing is they don't get reported. That's the problem. Only 3% of the errors get reported. Rest of the errors are brushed under the carpet. So this is a study by Professor Ashish Jha that says 5.2 million errors happen annually in our country. Professor Ashish Jha is from Harvard University. I think this is an understatement. There must be many more than what we are seeing. Also, most of the errors are around medication errors or patient care errors. So you can, and even surgical errors. A lot of errors happen on the surgical side also. And if we are able to make sure that we communicate effectively I think these errors can be prevented. How many people do you think get involved in a simple procedure like blood investigation? Any idea? Simple blood investigation. Admitted.
6 to
Patient
8 people.
Sorry?
6 to 8 people from
5 people.
reception to
Absolutely. 6 to 8
5
people.
people.
And that many opportunities of error. I completely agree. And that many opportunities of error. In an average day of 3 to 4 days, patients' information exchanges how many hands? Guess. Guess.
35, I guess.
15 to 20.
Yeah, 30 hands, 20 hands.
50 to 60 hands, and that many opportunities of error. And if we communicate effectively between us, actually, we could give a coordinated care. That would bring more coordination between us. Unfortunately, we all are working in our own verticals, in our own silos. We just look after our department, but we don't care what is happening in the other department. As a result, we actually do a lot of damage to the patient than doing any good. So we are going to do a small activity. And also, let me tell you, most of these errors are because of internal communication failure. It is not the patient, it is we who commit a lot of errors. Let's do a small activity. So I'm going to put 5 of you in the waiting area, and I'll bring you back one by one. So I'm not choosing anyone, but whoever name comes top of the list, I will be taking you out. Deepika, you are going out. Your name comes first. So you're going to the waiting room. Dr. Manisha. Dr. Manisha, your name came and it went. Okay. Yeah. No.
Dr. Indu, sorry to interrupt.
Yes.
I just wanted to ask everyone because continuously there is interruption in the lecture. So is it with my connectivity or others are also facing the same issue? Like in the lecture, there's a breaking of the lecture. So I just wanted to know if everybody else is experiencing that, because I changed my position also from one room to another, but it's still a lot of interruptions.
No, Dr. Neha, it's absolutely clear for us.
Absolutely clear for us. Yes, for me.
So because I keep on conducting meetings, everything from the same my study, but I changed from study to the other bedroom, but still it's the same. So probably I'm facing some issue today.
Maybe some network issue on your side here.
Okay.
Okay, so who is going? Dr. Manisha, I'm sending you to the waiting room. Okay. Next is Dr. Aparna. 3. And then Mamta. 4. And then one more person. Aditi. Okay. Okay. So I need one person here. So maybe Dr. Priya, I want you to take the lead. Rest of us will be actually listening and observing, but you are the one who will be, participating in the activity. I'm going to show you a slide, which is going to be visible to everybody. I want you to read that slide. And then when I enter one person from the waiting room, you have to share that information with that person. That's all. Is that okay?
Yeah.
I'm going to share the screen with you. Is this screen visible?
Yes.
So you can read and let me know when you're ready. You're ready?
Yes.
Okay. Okay. So I'm going to enter Aditi. So let me just inform her what we are doing, and then you share the information with her. So Dr. Aditi, Aditi, Dr. Priya is going to share a set of information with you. Please listen to her carefully. Dr. Priya, please go ahead.
Dr. Aditi, we've had a 21-year-old male patient at bed number 1 with a calcified tumor at the junction of third and fourth rib, and was operated by Dr. Shetty. And patient has complained of numbness in the nipple area. But Dr. Shetty has left for the day, and this telephonically he has informed us that we need to inform the neurologist immediately for a management.
So Aditi, is that okay, or you need some more information?
Information is okay, but I just want to tell I'm not a doctor. So the medical terms, I don't get it.
Okay.
Otherwise, admin terms like how to manage and stuff, that I can tell.
Okay, it's all right. I understand your challenge. I think I'll enter Dr. Manisha first. Aditi, you be observer. That's okay. There's no problem. That's perfectly all right. So Dr. Priya, I'm admitting Dr. Manisha. So whatever you have shared with Aditi, you have to share with Dr. Manisha once again. Dr. Manisha. Dr. Manisha, Dr. Priya has a set of information she's going to share with you. Please listen to her carefully. Dr. Priya, please go ahead.
Dr. Manisha, we've had a 21-year-old male patient at bed number 1 with a calcified tumor at the third and fourth rib, operated by Dr. Shetty. And the patient has complained of numbness in the nipple area. He is left for the day and has informed telephonically that a neurologist has to be consulted immediately for a management.
So Dr. Manisha, is that okay? Dr. Manisha, please unmute. Yeah, speak, please.
Dr. Priya said that there was a patient who was operated and the patient had numbness in the nipple area for which a Dr.
Manisha, keep this information with you. I'm going to add another person from the waiting room. You have to share this information with the next one. So I'm taking in Dr. Deepika. So you have to share this information with Dr. Deepika. Dr. Deepika, yeah. So Dr. Manisha has a set of information she's going to share with you. Please listen to her carefully. Yes, Dr. Manisha, please share with Dr. Deepika.
Dr. Deepika, Dr. Priya said that there is a patient who is operated and the patient has numbness near the nipple area and the neurologist has to be informed.
Okay.
Is that okay, Dr. Deepika?
Yeah.
Okay. So I'm admitting the next person, and that is Dr. Aparna. Please share this information with Dr. Aparna. Let her come. Dr. Aparna, Dr. Deepika has, I'm so sorry. Yeah, Dr. Deepika has a set of information she's going to share with you. Please listen to her carefully. Yes, Dr. Deepika, please go ahead.
Yeah, so I got to know from Dr. Manisha that there is a patient who has been operated and she is complaining of, I'm not sure about the gender, the patient is complaining about, yeah, it is a female, sorry. She is complaining about numbness in the nipple area. And so, we have to refer her to a neurologist for this concern.
Dr. Aparna, is that okay?
Yeah, what I got is there's one patient,
Hold
female
on,
patient.
Hold on. So I'm admitting Mamta. Please share this information with Mamta. Hold on.
I have to share the information with Mamta, right? Okay.
Let her join.
Mamta, has she joined?
Let her come in. She has not yet joined. Sometimes it takes little time. Yeah.
Right.
Mamta, are you there? So can you have your camera on? Okay. So Mamta, Dr. Aparna has a set of information she's going to share with you. Please listen to her carefully. Dr. Aparna, please go ahead.
Okay, there's one patient in the waiting area who has come for consultation. Is a female patient complaining about some pain around the nipple area.
Okay.
So Mamta, what did you understand? Can you explain in your words?
Yeah, patient is coming with pain in the breast at the nipple area.
And she has to be.
What?
And she has to be referred to the neurologist.
She has to be referred to the neurologist? No.
Yeah.
She has to refer to the...
I'm not asking. That is the information we have, that she needs to be referred to the neurologist.
Okay, that can be corrected. Instead of neurologist, she can be sent to the gynec.
Okay.
Okay, Mamta, so whatever you understood, please explain to everybody.
So I understand that a lady comes and with her pain, and she has to be referred to the neurologist. But I feel that rather than the neurologist, it's better to send her to the gynec.
Hold on. What happened?
The gender changed, the disease changed, everything changed.
Everything changed. Message changed. Patient changed.
Everything changed. Patient changed.
Bed number is not
Gender,
there.
disease.
Yeah, so
gender,
when
disease,
Raise
everything.
your hand. I will request you to raise your hand so that, yeah, Dr. Manisha, go ahead. Yeah.
So when the information was passed to me, there was not very clarity due to the communication. There was a signal issue.
No. We will not talk and those.
Yeah. So because I didn't
And more than
convey.
participant, I think I would want observers to share their thoughts. Hold on, Dr. Manisha. Yes, Dr. Kundan, go ahead.
Actually, what happened to the message is, as it passed through multiple levels of the informant, the message got changed, it got altered, it got, and ultimately the person, the last person receiving, he got a totally different message and different patient, and everything changed. And ultimately, maybe it was all different.
So, Dr. Neha, tell me what exactly changed. Can you give me 1 or 2 points that got changed?
Yeah, first the gender changed because male to female. Then even the patient was admitted in ICU. It was said the patient came in the waiting area. Patient was operated. So it was a tumor in the 3rd and 4th rib area. So that also got changed. And I mean, the concept that pain, it was the numbness. So numbness got changed to pain, because it was numbness which was felt by the patient. And then the doctor who was the surgeon had already left, so the referral was to be given to the neurologist, which finally the last person felt it should go to the gynecologist. So in fact, everything.
You may be wondering that these people made a mistake. They did not take it. Had it been any one of us in their position, Dr. Amrit, hold on. Had it been any one of us in their position, we would have made the same mistake. We would have made the same mistake. So they are not to be blamed. So Dr. Aparna and Dr. Manisha and Priya and everybody, don't feel bad. It's not your fault. But this activity I just did to help you see. We say patients don't understand. They don't communicate well. They don't pass on the information properly. They don't narrate their problems properly. We are all healthcare professionals.
We don't.
Just look at our own communication skills.
We don't, yes.
Dr. Amrit, you wanted to add something. Go ahead, please.
I am just saying this, that in all the steps, everybody was filling with the gaps with their own prejudice and their own idea. Because everybody wants to make the message wholesome. By
So
whatever
the cognitive processes, like
so we
selective
are
listening,
adding our own,
selective listening, selective attention, selective forgetting. and then assumptions. Everything interferes with our listening, understanding, and then communicating. I think this activity should open our mind to the idea how communication feels. And now, if I may tell you, I'm sure those who were outside and those who joined late, they have not seen this slide, so they want to know what exactly was the information. I'll share that slide with you, but I want to share another fact about this. This was a real life case. This was a real life case. Let me show this slide once again for everyone. There we go. Read this for your interest, for your understanding. Everyone. And you know what was the outcome? Do you want to know? Unfortunately, the seriousness of the situation was lost. Neurologist came to see after 16 hours, and patient went into irreversible paraplegia. Imagine 21 years old, young boy. So we may cover up with anything, but you know the reality. So hospital had to compensate and do so many things, to cover that up. But this is the reality. So if we communicated effectively between us, patient safety and continuity of care will automatically be looked after. So those of you who are talking about patient safety, you are not wrong. You are not wrong. Communication failure is the lead cause of compromised patient safety. We don't communicate effectively. We don't communicate. By the way, how could have this whole thing, been prevented? Can you think of some ways?
What I felt was the
Maybe
way the
everything
message was
given in writing.
constructed was a little.
Everything given in writing.
Okay, maybe it's better if you either write in the chat box or maybe raise your hand so that I can ask you to speak. Okay, Dr. Amrit, you want to say something? Go ahead. Yeah.
I think written exchange of information is far better idea.
A lot of written information comes from different departments. How many of us read the whole case sheet thoroughly? So that means written is important, but again, do we have time? Did we have time to read that? Absolutely, I agree. Written will definitely be very effective. Okay, what other ways? Dr. Neha, you raised your hand. You want to say something? Unmute your device. I think your device is on mute mode.
Okay. Written as well as communicating verbally, because both things complement each other, because one thing will never suffice.
Absolutely, I am spot on. Dr. Priya has pointed out a very important point, urgency to be specified. It was there in the message. Call the neurologist on urgent basis. But nobody noticed the message properly. Information should be documented. I completely agree. Follow up. Absolutely, I agree. Dr. Sneha. Follow up by whom? By whom? And with whom?
By the one who had given the original order.
Absolutely. If I'm the surgeon who has operated this patient, and this patient is complaining of numbness, and I know there is some neurological impact and I need to get it corrected, as early as possible, and I've given the order, but just to make sure that things get done, even if I'm not there, a small call back to the department in 5-10 minutes. Has the neurologist come? Or even calling the neurologist directly and telling that there's a patient in the ICU on bed number 1. I've operated him and this is his complaint. Can you immediately go or send somebody to go and see? These are all small actions.
Ma'am, verbal orders have to be repeated twice.
Absolutely. Correct. So verbally, if somebody is ordering, note down and repeat to tell that this is what I'm understanding.
And we need to make it a teaching moment to our team that this is an urgent matter.
Absolutely. Yeah. If there's no knowledge, there is no urgency. What mind does not know, eye does not see. If we didn't know, that this is an urgent condition, we will not understand the urgency. So the nurses, residents, they should know in such cases, this is an urgent emergency. This need to be dealt at the earliest. Otherwise, we can have, a long-term impact. So see, so many things. Closed loop communication. Yes, very good. Some of you have written. Ask the person to read back. Absolutely. One of the best ways to confirm whether the person has understood. Ask, आपको समझ आया? हाँ, क्या समझ आया बताओ. They will tell you. अभी बुलाना है, urgent, अभी. I'm sure the staff would have understood that this has to be. And then concern for the patient is bottleneck. We don't talk all this to patients, honestly. अगर पेशेंट को पता हो और फैमिली को पता हो कि ये बहुत अर्जेंट है, वो बहुत हो हल्ला मचाएंगे, पर कम से कम पेशेंट तो बच जाएगा. Unfortunately, we don't share information with the patient, fearing कि वो हमारे सिर पे चढ़ेगा. But very honestly, they are their best safeguards. Who would be more interested than them to save the patient? We have to engage them. We have to involve them. So seriousness should have been explained by the surgeon. Yes, should have been explained to the patient and also to the staff. कि अगर ये होता है, तो please immediately call the. Have protocols. Have protocols in place. So, I mean, you have given wonderful points in your this thing. So I think this gives us an idea that patient safety and continuity of care can be ensured if we communicate it effectively between us. Of course, your day-to-day friction would go down if you have good rapport with your staff, if you have good understanding with them, if your relationship with your resident is good. I see a lot of bosses being very arrogant and rude with their residents, insulting them in front of patients. Sorry, you're increasing your own problem. I was asked this question in one of the programs that I took, and it was a very senior consultant who asked me. I said, if you are insulting or embarrassing your resident in front of the patients, they will never trust your resident. For every small thing, they will want you to come and explain, and then they will understand. So you're creating more problem for yourself. Your relationship with your nurses, they are your backbone. They are the one who execute your orders. They are the one who can be your informers. But you need to have good rapport with them. So day-to-day friction with patients, with your family member, with staff, with your residents, that can be improved if you have good relationship with them and you communicate effectively. Interpersonal skills, which we are going to talk in the next session. Your interpersonal skills, which will help you have good rapport with your team. They are very essential for your success and your happiness. Of course, your conflicts with the staff and patient will go down, because if you communicate well with the patient, with your family member, definitely they'll have more trust in you. They will not doubt you, or they will not argue with you. Even the intense communications like end-of-life care, grief counseling, breaking bad news, all that can be handled well. This I shared with you in the last slide also, that, I mean, we know almost 8 out of 10 doctors are not good at breaking bad news, or not good at grief counseling or end-of-life care. We really need to learn this in a proper manner. Studies have shown that in almost 2/3 of the cases where the patients sued the hospital or the doctors for medical negligence, the problem was not medical negligence. Problem was poor communication. When the patient feels, one second, I think Dr. Sneha. Dr. Sneha, are you there? I think she lost network. Sorry. Yeah, Dr. Sneha was out. So in almost 2/3 of the cases, the problem was not medical negligence. We did not communicate well. We did not build rapport with the patient's family. We did not explain them. We did not prognosticate them. They thought we haven't done enough, and the patient died. We do everything for the patient, but we do not communicate with the patient's family. So it is something like winking at a girl in dark, which you know she does not know. I think Dr. Kundan will only understand my point. So it's important to communicate. And also, some other studies also say that one of the primary reasons people decide to file a lawsuit is not negligence, ineffective communication. So effective communication can actually reduce the risk of litigation. If you talk to your patient, address their concerns, satisfy them, explain them properly, you can actually prevent these situations for you. Even the risk of violence can be reduced if you communicate effectively beforehand, not only in this situation, much before the situation. Of course, this is going to help you to improve your personal and professional satisfaction. We are talking about physician burnout. Why? It should give you so much of pleasure that you should go back happy and satisfied. But unfortunately, the situation is very different. I'm going to stop the presentation here. I know we have gone beyond time. So sometimes when all of you are motivated to discuss, we go beyond time. There are a couple of more slides, but I will not stop you further. It's already, I think, 10:15 in your watch. We'll have this discussion in the next session. We'll cover these slides and then we'll start the second topic in the next session. I'm sharing the feedback form with you, and I want you to give your feedback for this session and also decide the next session, next day, because this time we had on Friday, but next time we are not going to have it on Friday. Give me a second to take the link and bring it here. Yeah. Let's finish the feedback form and then just check if I've given you the right feedback form. Have I given you the right feedback form?
It is not getting clicked, all those. I think some problem is there.
Let me try once again. Let me try once again. Try this link once again. Is it working now?
Yeah, this is.
Sure.
I think this is feedback form, yeah.
Dr. Indu, is it possible to post this on the group so that we can fill it later on, or is it to be done right now?
Do it immediately. It's just 2 minutes. It's just 2 minutes. I think one of you have already finished it also. Somebody has already finished also. It doesn't take much time. Yeah, Dr. Kundan has already finished. I've kept the feedback form very simple, but feel free to give your honest feedback so that we can improve the program. So don't hesitate in giving the honest feedback because we want to improve the quality of the program. So I've received 7 responses as of now. So by the time others complete their feedback form, about the days, I think right now I just have one day which is free, that is Wednesday. So Monday, Tuesday, Thursday, and Friday all are already, there are programs running or they're going to start from next week. There are a couple of programs that are going to end very soon. So maybe we can reconsider the day. But as of now, we just have only one day, and that is Wednesday. Is that okay with all of you?
Yes,
Yes,
It's
ma'am.
okay with me.
If anything is to be changed in timing, ma'am, can it be done during daytimes if everyone is having the time?
Honestly, Mamta, I think everybody will prefer only evening because all of us are in the hospitals and working. So this is
Yes.
you can attend the program in a very relaxed mood. Only thing is finish your evening chores beforehand, and then
Yeah, sure, ma'am. No issues. No issues.
I think you can sacrifice for this program. You can sacrifice.
Definitely, ma'am. Definitely, it's more worth it actually.
I can see your child with you, and I can see his eagerness to be on the
They are
class.
waiting me to take them to bed actually. Yeah.
So sweet. So if you have done, you can log out. I think most of you have given your responses. I've received 9 responses. We meet next Wednesday. That is, I think, 20th, if I'm not wrong. Let me check. No, it is 19th.
Okay.
Right, ma'am. Wednesday.
Okay.
Yes. Okay, ma'am. Bye-bye. Bye, everyone.
Thank you
Good
so
night.
much. Thank you, Dr. Indu.
Thank you, everyone. Thank you.
Dr. Indu,
Thank you.
Dr. Indu, can I just ask you, like we were talking, although you said it's jam-packed, any chance way forward to have it twice in a week?
So Dr. Neha, I'm coming back in the end of April, like on 2nd of May, I will be in India.
Okay.
By then one of the program will be complete.
Okay.
So then we can always sit and discuss. I'm open to changing days and dates as per the group decision. So,
only thing was just if everybody agrees, though, so that at least we are not bound and we finish it quickly. That was the thing.
For me, some of the programs I will have to do while I'm in travel. So immediately after going from here, I have a lot of travel. So I will have to really have everything, wherever I am in a hotel, late evening, 8 to 10, I will have to be, log in and doing the program. But that's how life is. Let's enjoy. Let's be happy. Okay.
Ma'am, so when is the next?
19th Wednesday, 8 to 10 p.m.
Okay, ma'am. Thank you.
Okay. Thank you so much, everyone. Thank you.
Thank you. Thank you, ma'am. Thank you, everyone.
Thank you.
Happy weekend.
Thank you so much. Thank you.